All right. Good morning, everyone. I am Councilor Dana Gutwein, and I'm here today with my colleague, Karen Harrison, my fellow councilor. Hi, Karen. And also here with Sergeant Alesch from the Police Department. We're so thankful to have you here today. And we'll introduce you in just a moment. So just to kind of welcome everyone, typically every month we have a ward meeting on the first Saturday of the month, and we all go to the local church, and Karen and I bring donuts and coffee, and we have a conversation and give you updates in the community, what's going on, and also listen to your concerns and what's on your mind. Unfortunately, right now we are not able to do that. So we still want to continue the conversation and keep you informed, and also answer the questions that we've been getting from the community. So we are trying our first Zoom ward meeting. So we know it's not ideal, but we're doing the best we can with what we have. So on that note, I really want to thank Sergeant Alesch. We had him scheduled to come with us for our April ward meeting, and we're lucky to have your time here today, and we really appreciate everything you do for our community to keep us safe. So welcome and thank you for your service. So we have a list of questions here. I'll just get started. We had basically, for anyone who doesn't know, could you explain a little bit about what the Community Action Team is and kind of why it started, and maybe also your role in the Lakewood Police Department?
Yeah, so Councilor, I want to thank you, and thank you to Councilor Harrison for this. I think it's good when we're finding new normal to still have something like this happen as often as possible. And so I'm glad to do this anytime you need, and we'll make sure to keep everyone updated about what's going on. So again, I'm Sergeant John Alesch. I work for the Community Action Team at the Lakewood Police Department. I have been with the department about 15 years now. And to start, I'll tell you that the Community Action Team was born at the end of 2017. The police chief, Dan McCaskey, realized that we needed to have a team that focused on homelessness, mental health, community problems and issues. We had a team prior to that focused on the community problems and issues, but didn't really specialize in homelessness. And so he approached City Council and the City Manager and said, I would really like to increase our efforts in this area. And luckily for us, City Council approved, and we increased our strength. So currently we're at a strength of 10 officers and 2 sergeants who are able to go out and help with community problems, homelessness, mental health issues, etc. We also just started our first homeless navigator last week. So that is someone who is dedicated to kind of being that next level of help for someone who's homeless. So we refer to them. We're also going to start putting out ways that the community can reach out to the homeless navigator directly once we get her trained up. And we're working on hiring a second one. So that's some of the things that are going on right now with the Community Action Team.
Awesome, thank you. That's really exciting to hear that our first navigator is starting.
Yep.
So that's phenomenal. I know, this has been something we've been working on for a long time, and it feels especially important right now.
Absolutely. That's one thing where it's kind of tumultuous for her, because if you can imagine starting a new job amid COVID,
yeah.
She's kind of like, okay, so hi, and we're like, hello, come on in, welcome to the party. And so, but yeah, she's been awesome so far. What we've really used her for so far is there was a certain landscape of facilities and services available to the homeless before the coronavirus outbreak, and now everything's changed a little bit.
Wow.
So you have shelters that we're operating that aren't right now because of it. You have other groups that are, health centers that are operating under odd hours, food banks. The Action Center is doing an awesome job with walk-up and drive-through only now, so they don't have in-house services currently to help with the spread. So it's a very different world right now. And so we're fortunate to have Princess. She has really started to take off and work directly on identifying resources immediately. So she has been basically hitting the phone keypad quite a bit and making calls and setting up those relationships. So
amazing. That's fantastic.
Excellent.
Yeah, and so that kind of brings us to the next question, is just how have your day-to-day life and how have things changed in the police department and also the CAT team since COVID started.
Yeah. So I think day-to-day life personally, I'll tell you, it's not much different because as an essential employee, you know, in public safety, much like firefighters or, you know, street maintenance crews, we still come to work. So the only thing that's really changed for me is a much better commute because there's so little traffic on the road. It makes it super easy to get to work. So I thank everyone for staying home because it gets me here in about 10 minutes where it used to take about 20. So, so
good. Well, that's good to see.
yeah, trying to find the bright sides, right? So how have our responsibilities shifted and changed? You know, the CAT team's still committed to getting out there in the community and interacting with those at-risk populations like the homeless. We still go out every day and engage with the homeless in the parks, on the streets, in business parking lots. But we also are recognizing that we have to change how we do things. We used to do a lot of really proactive outreach where we'd go out and just contact people. We're trying to not do as much of that right now because we're trying to limit that social interaction. So we're doing a lot of work out in the street. And if we see someone who looks like they need help, we'll still contact them, but we're not doing like full day operations where we're going out and contacting people. We are, though, like today and because of the weather, so as we're recording this, we're in that kind of sleety, snowy, getting down in the 30s after our beautiful 70-degree weather yesterday or whatever it was. In these days, what we're doing right now is we're doing a lot of direct contact and saying, hey, you know, are you preparing for the weather tonight? You know, what do you need? We're offering transportation via the bus system. You know, we've purchased a bunch of bus tickets and we're saying, can we help you get somewhere that has shelter? So we're doing those. They're out there doing that right now as we speak. So
wow.
I think though, the one other thing to mention is one thing you may see from the CAT team too, is we are a patrol team. And so our first job is to support the patrol division. So one thing we are ready to step up to do is if any of our patrol officers become ill with the virus or have to go into preventative quarantine, we may step back into a patrol role to help for a while too, because that's the first priority of a police department is public safety.
Mm-hmm.
So that's something we're preparing to do and we have contingencies in place. So.
Thank you. Great. And one thing I forgot to mention at the beginning, we are recording this on Thursday, April 2nd, and then we're going to air it on Saturday. And so if there's any, you know, big breaking news that happens between now and then, we certainly won't be able to cover that. So just want to point out it is Thursday for us today.
Yeah. I left my crystal ball at home today, so I can't tell you what's coming yet. So.
Well,
and my tea leaves didn't have anything in them either.
Oh, so yeah, so a couple questions about that. You know, one thing that's a concern for me, just thinking of all of you out on the front line, do you have any extra, are you wearing PPE? Are you concerned about, you know, catching COVID or any differences and changes in the way you're handling that? And for our patrol agents too.
Yeah, I mean, we're all obviously concerned about catching it, like I think the general public is. Yeah. You've started to see law enforcement agencies across the country reporting, you know, infected within their ranks, and I think it's not a matter of if, it's a matter of when. Yeah. You know. Mm-hmm. So I think we know that. At the same time, you know, we are very fortunate. We have the proper PPE right now. We have those. You know, what's funny is I think prior to this outbreak, who knew what, you know, flattening the curve was, or right. Dr. Fauci's name, or N95 respirators, right? But now it's oh yeah, my daughter who's 7. Do you have an N95 respirator, Dad? Yes, I do. So those N95 respirators, we have those for each officer. They're encouraged to wear those and eye protection on any contact that's going to be close distance, you know, less than that social distancing range. And we also have plenty of rubber gloves. So we have that PPE. We also have, because of our role, we also have the really big gas masks. Wow. And those actually work for it too. And every officer has one of those that covers the whole head and face. Right. That's a backup option. But for the day-to-day, we have N95 respirators, iPro, gloves. We also have been issued hand sanitizer. We've been taking large bottles and making small portable ones for the officers to take out. And then we actually had, I think it was at a Loveland, a distillery donate shot glass bottles of distilled alcohol.
That's awesome.
So, and we have to remind everyone to use that on their hands.
Yeah, exactly. Don't.
So, but they donated a bunch of those, so we have those too. So it's been really cool to see that kind of community support. And then we also have the more standard surgical masks for arrestees who might be sick. So, because that's one of the best ways to prevent transmission is not for us to mask up, but to mask up the person who has symptoms.
Right.
Because then you protect everyone around them by getting them to cover their cough. So we're just fortunate to be equipped during this difficult time. And we know that not every agency in the nation or even the state, has the same level right now. And we're very glad that we do. So.
Wow. That's
Excellent.
That's so good to hear.
Yeah.
And that is just such a, like, one of the good things, like you mentioned, trying to find the positives out of this is it's so amazing to hear these stories of people stepping up and like the Loveland Distillery donating hand sanitizer. Who knew how valuable that would be?
I know, right?
Yeah. And I'm just really thankful for all the bravery, and I'm so lucky because I get to stay home, and I just have to be a PE teacher and teach my kids and try to figure out work stuff. But
Google Classroom is a new thing, right?
Yeah, it is.
But for everyone who has to, grocery store workers and just everyone who has to be out in the community right now, I'm just really amazed by all your bravery. So.
Yeah.
Thank you for.
Oh, absolutely.
Yes, thank you very much, John.
Yeah.
All right. So I guess the next question is if there's just any other changes to the way that PD is responding during COVID. I think we'll talk a little bit about the rules later on, but are you seeing any other big changes in during this time, or maybe shifts in what kind of crime you're seeing, or everything else kind of?
Well, yeah, we can go into, so the way that the police department as a whole is responding to it, we've taken steps to protect ourselves and the public as much as we can. We're following those same social distance guidelines. I had a team meeting yesterday with my team, and we all sat spread out outside. We really have limited, we have what's called roll call. It's our daily shift briefing, where usually you'll have between 15 and 30 people in a room to get ready for the workday. We've eliminated those for now, so we're not having big mass meetings. All in-person training has been canceled for now, so any work where we'd be bringing people together from different shifts and everything, that's been postponed. And more importantly for your constituents and the people that live in your ward, you will have seen a change to our response to crimes. So non-priority crimes that have occurred days prior, or even if they occurred a couple hours ago or an hour ago, those we're trying to handle over the phone. If there's not a reason to, come into close contact, it's not worth it. And that's one, it's because we need to keep our police force healthy so we can continue to do the job we need to do. But also it's because like you said, Counselor, you mentioned that you're fortunate to stay home right now. Since we're not, it's something where we're exposed to a lot of different people, and with this virus, you don't know who might be carrying it, and you could be healthy and carrying it. So we don't want to expose the public to us as much as possible, because there's a chance that we could be carrying it and we don't know. So why, if you come out and find out that your mailbox was knocked over by some kids the night prior, why would we want to come up to you and be like, hey, we'll deal with this, but also have that risk. So I think it's a good thing for everyone. So we're also encouraging internet reporting. So that they can do that through the lakewood.org website. But with that all said, we still want people to know we still respond to in-progress calls. Public safety calls that are in progress, we're still coming. And we're going to do our standard job that we've always done. And we're going to protect the citizens at the same level we have. One thing that's happened countywide to be aware of is we've seen a change in our arrest standards have been modified. So for lower level criminal activity and crimes that do not have a public safety risk, we are either issuing tickets instead of arrest, or delaying some of those types of things to
Mhm.
reduce, one, the amount of people that are arrested, and then two, to reduce the intake into the jail, because the jail population right now is a high risk population
Right.
because there's a good chance it could spread there. So you will see that as well, and that's countywide. That's with us working in tandem with the sheriff and the other police departments. And that's been an agreement across the board. So.
John, I wanted to ask a question to follow up. When you're talking about an auto accident, would they still report just regularly? Do they still need to call everything in if there's no injuries? Is it like accident alert?
Yeah.
Or how are you handling that?
Yeah, my understanding right now is you still call it in, but you'll get that direction as far
Okay.
as that. And if we're still remaining on accident alert, and that's something that's always up and down, but that has been employed as part of this, is you'll get the directions you need. So still call, tell them you had the accident, because if someone's injured, if one of the cars is not mobile, we're going to have to come out. If someone appears to be intoxicated, we need to come out and handle it. So the best answer still is to call. Just be prepared that you may be told, okay, because a lot of what we do now is online reporting again through the state.
Right.
Because if it's an accident alert accident, the only requirement that you as a citizen have to do is make the report through the state system. So through our website and through also State Patrol's website, you can do an auto report later.
Okay.
But always call us first, because we want to run through those things with you. You know, especially
Injuries, intoxication.
injuries,
Right.
intoxication, vehicles not moving.
Right.
You know, and we would rather have that dialogue with you and make sure everyone feels comfortable about doing that internet report than not calling in the first place. So.
Okay, thank you.
Yeah.
Great. Yeah, I guess, asking the question of what's changed is kind of a funny one, because everything has changed.
Yeah.
So,
Truly.
I think that the community is going to be really comforted to hear all the things that you're doing and the way you're still prioritizing public safety and looking out for our force and also our community. So, so I want to ask one more question about homelessness, because this is something that, we've all been really passionate about. I know, Sergeant Alesch, you've been working on this for many years and trying to increase services and all of that. Are you seeing more people, more of our neighbors being pushed into homelessness right now? And are you seeing greater need as people are starting to lose their jobs and losing their incomes and that kind of thing?
Yeah, I think there'll be a lagging indicator there, because I think we won't know for a little while the extent of it. A couple things I can speak to. One, for chronic visible street homeless, one thing that's always worth mentioning when people are going to when they're doing the few things you can do right now outside, you may see an increase in visible homelessness. One reason for that is the warmer weather always brings a visible increase to the suburbs. There's a natural tendency in the winter for people to hunker down or find a family member or a friend where they can stay, and then when it's warmer out, they can stay overnight, on a sidewalk, under an alcove without risk. So you're going to see an increase anyway during the warmer months. So it just so happens that aligns with this current outbreak. Additionally, I think the homeless are a lot more visible right now because of the lack of normal foot traffic. Public areas are normally publicly trafficked, and since a lot of people are staying at home right now, the only people who are remaining there are the homeless. So when you do go out, you're like, oh, look at this. So I think that's another thing. To your point though about what are we going to see coming, I mean, you see reports every day of record jobless claims, all that. I think we'll have to wait to see what the federal government stimulus does for people. I think also we'll have to wait to see what large businesses actually do, because you really don't know where they're going to be at. We are working, our team specifically, and the city, and then our groups that have federal, state, and local funding, in coordination with the county. We're trying to identify what resources we will need, because there is that chance that there's some folks who kind of have been living on the edge of homelessness for a long time, right? Maybe their husband and wife are both food industry workers, and they've been paying for a motel room for a while with their kids, but now that the restaurants are shut down, they've been laid off. And so we're kind of waiting to see the fallout from that, and we're trying to find ways to prepare and through different funding sources locally and through the county and by our state federal partners, how can we best mitigate that? And so that may be a combination of shoring up rental situations, like saying, hey, if someone comes to us and says, hey, the federal government says I can borrow from my 401, I should be able to do that the next month. If I can get someone to help me with this 1 month of rent, I think we'll be okay. That's what it may look like down the road through all these partners. For some folks, it may be, temporary housing, trying to identify temporary sheltering locations, hotels and otherwise. And it's also a process of trying to identify how do you do that amidst a health crisis. So it's a complicated issue, as you know, but the discussions are being had. So that's the good news is we're working on it. So.
Yeah, I think, and that's probably the case for so many of these challenges that we're going to face is we don't know yet what the extent's going to be. And so right now we're all just trying to, figure out what the extent is and then come up with a solution as quickly as possible.
Absolutely.
I'm going to jump out of order just a little bit because it fits in. One of the questions we had is just, what can people do to help right now? So if there's anything you have.
So I think the first thing you can do to help is stay home. Like everyone needs to understand that this fight will only be won if we, and it's funny because again, how many of you thought a cop would be talking about a public health virus situation, right? I mean, this is the world is weird right now, but the only thing we can all do collectively as a community is keep our hospitals running at a pace that they can keep up with things, keep our hospitals at a pace where they can still handle normal issues like heart attacks and strokes and those kind of things. Because people sometimes forget that that's a side effect of this. If all the beds are full of COVID patients, where's the guy with the stroke go? And so staying home is the number one thing people can do to help. And staying home means literally staying home. It doesn't mean having a block party with your neighbors. It doesn't mean saying let's get all the neighborhood kids and go to the park. Like that's the opposite of what we're trying to do. So we really need, especially in your ward where it's a true like suburban setting in a lot of cases, understanding that you need to just stay home. And that way because the problem is once it spreads, it's just going to geometrically rise. That's what we've seen with anyone who's been watching this graph. It just trend straight upward, and so we got to flatten that out. So that's the first thing. The second thing is I think right now there's the Colorado Volunteers websites that are out there you can look at. I know the governor started the volunteering website that's still going on. The other thing to do, and I think we can all agree we're fortunate to have the internet in a time like this. I can't imagine how much more difficult it would be before these types of meetings.
We couldn't do it.
We couldn't do it. I mean, we'd all be on the old party line, with the phone.
Right.
Yeah.
Dana doesn't even know what that is.
Right. I know. Yeah. So, but I think the second thing is to visit the website of those organizations you trust and appreciate in the county and in your region. So, I don't want to mention any specifics because I don't like to play favorites, but, identifying those organizations that are kind of on the front lines. And whether it's giving through your wallet or identifying ways to help in other ways, that's something people can definitely do right now. So
awesome, thank you. And I am going to play favorites just really quickly because you mentioned the Action Center earlier, and they play such an incredibly important role in our community all the time, but especially now. And so I just want to plug here a couple things that they have an urgent need for. One is healthy volunteers, and especially if you're willing to work in a supervisory role at the Action Center. The second, of course, is donations. And I've seen some people, they're using this time to go through their closets or go through their drawers or whatever. If you have things that you can donate, there are people in our community, our neighbors that could use that stuff, and just put it to use. It's a great way to feel like you're contributing in this time where we all feel sometimes kind of helpless. And then, of course, non-perishable food. They're not taking, I don't think, anything but that's perishable. So non-perishable food. And they're even needing transportation to get food to people that are, staying at home. So all that information is on the website. If you're able to help at the Action Center, please do.
And of course, cash donations are always accepted.
Absolutely. Okay, so I want to shift again and talk about the rules. I think, people pretty much know at this point, stay home, or hopefully at least they know that's what they're supposed to do. Whether or not they're actually doing it is another question, but we're getting a question about the parks. Are people still allowed to go to our parks? And then what about playgrounds? What about all that stuff? And so could you explain, what are people supposed to do? Are they allowed to go to the parks?
Yeah, parks are still open. I checked recently, state parks are still open. But for our local parks, absolutely. That's the one, we have to find ways to stay mentally and physically healthy during this time. And that's, again, not to sound like the always, Johnny Upside here, but the thing is that people are getting out more physically, and that's really good. Like, I've seen jokes, where the dog's like, "You've taken me on 20 dogs walks today. I don't want to go again." So no, the parks are obviously open. What we're looking for is the high touch surfaces. So like playgrounds and stuff, although we know I have 2 small children, trying to keep them away from the playground is nearly impossible. But you need to, because those are the high touch surfaces that could transmit easily. Especially when the weather's warmer and they're not getting washed naturally by the rain and those kind of things. It's not a good thing. Basketball courts, again, there's a good chance for close physical contact. Those shouldn't be used. All those kinds of things. Basically, the rules for our parks follow the rules of the state, which is if you're out with your family, your immediate family, or if you live with roommates, you don't have to socially distance like you would, but with anyone else, if it's you and a friend meeting at a park to take a walk, you got to do at least that 6 feet. If you and your friend want to meet and walk the dog in the morning, you have to do the 6 feet, because we're trying to make sure that we don't have the virus hop from one house to another, and that's the way to do that. So yeah, if you and your husband want to take a walk, you don't need to be 6 feet apart. But if it's you and a friend, or you and a neighbor who you get along really well with, do that 6 feet. Keep it apart. Do activities.
So the rule, John, would be that if they're living together, they don't have to worry about the 6 feet distance. But if they're not living in the same house, they need to honor that 6 foot distancing.
Exactly.
Okay.
And I would still encourage, the one thing to keep in mind too, just because we want to make sure that everyone's kind of on the same page, is still, even if you have 5 kids and 2 of you, let's still not play that pickup basketball game amongst you, because other people are going to say, well, they're not socially distancing, so I'm not going to, so really we're those community areas we're trying to avoid. But for taking walks, walking the dog, throwing a frisbee from one to another, all that stuff, especially within your family, is acceptable. So
great, thank you. And yeah, I can I'll join you in trying to see the positive in things. And I think I personally love it, and I appreciate your optimism, because everything feels so doom and gloom all the time. But in our neighborhood, I've been riding the bikes with the kids, and I see more neighbors out now, and more kids riding bikes, and more people on walks. So that is a really cool, good thing that we're seeing.
Absolutely.
Okay, the next question. This is something we got also from the community. Is do you think we're going to start enforcing people staying at home, or trying to enforce the stay-at-home order more? Have you talked about that, or what's the conversation like in the department?
Yeah, our guidance right now is we ultimately, as a police department, it is against the law to fail to obey these orders, and so it is up to us to help enforce that if necessary. But the first thing is we want to work with the community to understand that we need to stay healthy and safe. That's it. That's what this is about. This is not an order and a law we're enforcing like don't steal from someone or don't drive drunk. This is, hey, you need to stay safe. So we're taking a different tone on it. So ultimately, to start, what I would tell you is that we're focusing on education first and emphasizing the importance of voluntary compliance. Other cities have done that as well. I know I just heard a stat that Denver had issued about like 600 warnings for this, Denver PD.
Wow.
You know, warnings, not citations, warnings.
Warnings.
And
Right.
the understanding there is to say, hey, and we're not tracking warnings right now, but we're basically just saying, hey, you know, if we see a, because again, especially when the weather's nice, you start to see those clumps in the neighborhood. You know what I mean? Of people coming together.
Yeah.
It's like, hey, so again, there it would be education first. Us saying, hey guys, we need you to understand. Do you understand the concept that we're trying to not get the virus to hop from your house to then your elderly
Right.
grandma you take care of, to then your friend who has COPD. You know what I mean? Like, and so we educate. And I think in emphasizing the importance of voluntary compliance with stay-home orders is what we're really looking for, and it's going to go a long way. Because if we make the, I think now is really a good time to remind everyone how serious this is, you know, and so when we have those conversations saying, guys, this is actually a life-saving measure. This is a measure to ensure that our community as a whole stays safe. So with that proper education, we think we're going to get majority compliance. Ultimately, though, if we have repeated violations, you know, if someone just isn't getting the message, yeah, that can result in citations, fines, you know, et cetera. So
What about businesses?
So businesses, so if businesses are still operating, that's a murky world because, you know, you really have to look at the fine print to see what's a essential business or not. So the best thing to do is if you see a business still operating, and also to keep in mind too, that all businesses are allowed to maintain minimum staffing to ensure payroll gets met, to ensure safety, security, right? So if someone has to go into if you see someone going into a gym, it may be the gym manager going in to make sure payroll gets done real quick. But for open to the public businesses where you have concerns, you can contact our JeffCom dispatch at 303-980-7300. Again, that's 303-980-7300. You can report it to them. If it's a Lakewood case, we have a team of detectives who already regulates liquor establishments and other kind of things. They're contacting those businesses to make sure they understand the orders and check to see if they're in compliance. You can also contact the health department. You know, their general number, 303-232-6301. Again, 303-232-6301. So again, we welcome people saying, hey, that doesn't look right. And they can call, and then either us, the health department, or the correct agency will follow up.
Okay, thank you.
Great. Okay, I think we're getting to the end here. I have a couple more. We're hearing, are you seeing any challenges with the 911 lines getting busy? You're just overwhelmed with people calling and wanting to know what the rules are, or concerned about symptoms, that kind of thing?
Yeah, no, I think, so medical calls have risen, which makes sense. So just so everyone understands, our dispatch takes law enforcement, fire, and medical calls.
Right.
So under that umbrella, medical calls have gone up, but overall call load has actually decreased right now. So I think, again, with people staying home, with not as many cars on the road, accidents have been reduced, other activities been reduced, you know, so traffic complaints have gone down quite a bit. So overall, actually right now, our 911 system is at a lower rate of calls, which is good.
Wow, that's great.
Yeah, and it's good because it gives us time, because now what we're doing on every call is we're screening for COVID symptoms.
Sure.
Because we want our firefighters or our cops to know what they're walking into. So there's some more questions. You know, it used to be you'd call in 911, what's your emergency? Now it's 911, what's your emergency? Okay, and by the way, do you have a fever? Do you have this? You know what I mean? So just that extra time, it's nice to have the lower call load to allow for that proper screening. So.
Wow. That's surprising, but it makes sense when you think about it. The no traffic, you know, less car accidents, all of that. So
yeah,
that's good to hear.
Yeah.
Dana, before you go, one of the things that I would want everybody to be aware of is the other day on a walk, I happened to walk through a neighborhood that West Metro was responding evidently to a medical call. And when they came out of the fire truck, they were in complete hazmat gear, complete with face shields and the what do you call it, John? The gown or the
they're like
white
Tyvek suits.
jumpsuit, and booties and the whole 9 yards. And we have to understand that that's not only to protect us, but also to protect them. So when that happens, it was kind of disconcerting for a moment when you realize, oh my gosh, then you understand what risks our first responders are going through. So hats off to you. I know it's not an easy job to do right now, John, but thank you very much.
Yeah, absolutely. I think one thing, we always like to have fun back and forth between firefighters and police, but I will tell you that the West Metro Fire Department right now and the firefighters are doing an amazing job. I think that they are in a very unique situation because, if someone calls and says, I think I have it, I can't breathe, and they get there, now they are taking on the responsibility of taking a COVID sick, possibly patient, into a small ambulance and sitting with them for the next 20 to 30 minutes.
Right.
So that's why that gear is necessary, is because it's such a high risk of exposure. And again, the key for all emergency services is keeping a healthy emergency service system up and running. Because just like keeping the hospitals up and running, we need to keep our cops and our firefighters up and running. And so, yeah, it's definitely, you will see them in that gear, but they're doing that. And the reason they're using kind of their bigger suits and everything is they are also to save PPE. They're deconning them instead of throwing them away. So instead of using like lightweight throwaway stuff, they're using their heavier stuff that they can hose off and spray down with bleach and then reuse. So but like you said, when you first see it, you're like, wow, okay. That's, they're in spacesuits right now.
Well, I thought maybe ET had landed again.
Right? Yeah, exactly. So
it's the new normal.
It is.
All kind of adjusting to, but yeah, again, I mean, when you hear that experience for our fire department and what they're going through right now, I think, everybody just really feels so thankful to the people on the first, in the front line. So
absolutely. So
yeah. All right. I guess the last question, just, anything else that we didn't touch on, or any other trends that you really want people to be aware of, and we'll try to do our part to help continue to encourage people to stay home for their own safety, but also for, you and the fire department and everybody else.
Yeah, so I think first, because I know a couple things to cover. One, people have been wondering, how are the kids doing out of school? Kids overall, I really worry for the moms and dads trying to do e-learning with their children. Those are the people that are the heroes right now. My wife is navigating that world and going, oh my. So it reminds you just how important teachers are in our world, because now all suddenly we're teachers, and that's not something we're very good at. So, but otherwise, kids are starting to get a little restless, but we haven't seen an uptick in criminal crime yet by kids. One thing we've done is our school resource officers who would normally be in the school are now responding to calls involving school-age children. So if it's kind of a out of control kid or a disturbance, they're available to go do that because they have that expertise. So because the schools are closed right now, so they're not sitting there. So another thing, I know we've had people curious. One thing that people have a lot of concerns about is domestic violence victims and child abuse victims at a time like this. For child abuse, obviously, social services is still fully up and running. Our crimes against children detectives are still working their full caseload. Patrol is responding to those calls. For domestic violence, we still have all the same services that we provide. We have a talented staff of victim advocates here who their sole job is to help the victims of violent crime, and some even non-violent crimes, but especially violent crimes through times. Right now they are doing calls instead. They used to come out and visit in person. Calls are the way they're doing that now. But they are keeping up to date on the availability of shelter beds for victims. They have other resources available, so that hasn't changed. Just the method of delivery may have changed a little bit. So I think for me, in closing, as far as trends go, what I would say is we're fortunate to be in Lakewood in Jefferson County in Colorado right now, you know, because we see some of the real crises and struggles that other states are experiencing, and our hearts go out to them, and they need to be in our prayers right now because of that. But I can confidently say right now, working in Lakewood every day, that we're very fortunate with our city, county, and state, because the government at all three levels has taken very quick and thoughtful action trying to reduce the spread of the virus. We've had great dedication to quickly stop, flattening that curve. We've had the right PPE, we have the right plans in place. We've quickly gone to contingency planning, and that will continue to evolve. Because when you try and change, like you said, the world's new, everything's different. Right. So with that, there's going to be some things that we learn do not work, and other things that do, but we're here to do that. So I think for your constituents, understanding that to continue to be successful, we have to be vigilant about still following public health orders. I think that one thing that happens is as the weather gets nicer and as the monotony of these orders goes on, people don't see people getting sick, they're going to kind of become a little bit more lax about following them, and that's where we could instantly see an uptick. I think until we get that guidance from the county, state, and federal level that we've kind of gotten over the hump, we have to remain vigilant. Mm-hmm. So I think the key there, though, is to understand is that while each of you do your part, and when I'm off duty, I do my part, that you should know that at the Lakewood Police Department, we're going to continue to serve this city and ensure that Lakewood is a safe place to live, work, grow, and quarantine while waiting out this public health crisis. So I think that's what you need to understand.
A new tagline.
Yeah, right? Yeah. We'll add that to our business cards for now.
There we go.
The 2020 edition.
Yeah.
So, all right.
Thank you. And I just want to put my mom hat on for a second, and I'm just so thankful for this conversation with you, but also so that whoever ends up watching this got to hear from you, because, you know, I feel so good about living in Lakewood, that this is such a safe place for my kids, and that everything that needs to be done is happening right now.
Yeah.
I just feel like we have the best police department in the world. I really do feel that way. And, so thank you.
Absolutely.
Hopefully other people will, get to feel the same comfort that I feel every day knowing you're out there. So.
Yeah, absolutely.
Thanks, John.
Thank
you. We think you guys are the best.
Yeah. Good to see you both again. Sorry it's not in person, but.
Yeah, that's okay.
Okay.
All right.
An elbow bump.
Yeah, elbow bump, the chicken wing, hello.
Yeah.
All right, guys.
All right, well, thank you. I think we can continue. I think you can sign off.
Okay.
How to do that.
Yeah, that sounds good.
Okay. All right.
Thanks, John.
Thank you.
Take care. Bye, everyone.
Bye-bye.
Bye.
All right. So I think it's now just me and you, Karen.
I think it is, and I'm still here.
Okay. Well, that was great.
That was excellent information.
Yeah.
I think we should all feel much more at ease knowing that all of that's going on behind the scenes, stuff that we didn't necessarily know about, but I think it really gives great comfort to know. 100%.
I feel better, and we even get access to the daily updates and all of that.
Right.
So, yeah. So we just have a few more things that we want to get through on our ward meeting agenda. So Karen, would you mind just giving kind of the update on basically, what's been happening in City Council?
Well, City Council has been having much the same issues as everybody else, and that is we had to learn how to use Zoom meetings. We had our first Zoom meeting a week and a half ago where we actually learned how to run a meeting virtually, and we spent quite a bit of time actually passing an ordinance which allowed us to have virtual meetings. Our charter, of course, didn't have that allowed for, so we did pass that. And we've got a lot of other things that we're working on, but because of this not being able to sit in the same room, one of the issues that we're concerned about is learning how to get public comment from everybody. So one of the things that we want to remind everybody that when public comment, we have Lakewood Speaks, which is a way that people can comment to City Council about issues that are on our agenda, and that you want to support it, you want to oppose it, you have concerns, you have questions. All of that can be addressed on Lakewood Speaks. So it would be excellent if you could public comment that way. We're still trying to figure out, because right now Zoom is our easiest and best way to have our City Council meetings. We're still trying to figure out how to actually incorporate more involvement. Hopefully we won't have to do this for any great length of time. And I think those are the things that, Dana, I'm drawing a blank. Do you have anything else we want to add to that?
Do you want to just explain a little bit about, you know, how the decisions are being made? Like, for example, when Denver did the stay in place order, we got a lot of questions about why isn't Lakewood doing a stay in place order?
Yeah, sorry, those were other things.
That's great. Yeah.
Lakewood is a home rule city, which means that we have a strong city manager and elected mayor and city council. City manager is different than a strong mayor, the way the city of Denver is, where he has the ability to make those calls and actually issue the stay-at-home orders and whatnot. We, as a city, have to wait until the county does that, because the county is actually who has the ability to issue that stay-at-home order. City managers did have a huge amount of input in that decision, and that's when the Jefferson County Public Health Department issued the stay-at-home order for all of us, and we're following that order. As what Sergeant Alesch was talking about, each city will help support that order in the manners that he identified, but it's actually Jefferson County that has the power to issue that stay-at-home order. So we defer, and we get updates on a regular basis from Jefferson County, as well as we also get updates daily, which are actually on the website. So every single day, Kathy Hodgson, our city manager, does an update, and you can go on to the lakewood.org website and actually see those updates day by day. She's identifying what's been done, what's coming up, what, waiting for certain things, what's been implemented, and it's a really excellent update, and I would encourage everybody to go online to look at it.
Thank you. Yeah, I'll just kind of echo that a little bit, that, right now things are changing by the day, even by the hour sometimes.
Correct.
And so if people want to know what's happening in Lakewood, the website's the best place to go. And it has the daily updates. And I just want everyone to know that we in the city are following all the rules, all the recommendations from the president down to Jared Polis, down to the county, to really prioritize keeping everyone safe, and then also getting back on the road to economic recovery as quickly as we can. And actually I'll use that as kind of the shift. One of the other questions we got, we have a lot of people in our community that are losing their job. We have a lot of people in our community that have a small business. One question we had is just what resources are available for small businesses right now?
Well, one of the things that I found was very interesting is the state has a really interesting program called Colorado Work Share Program. This is a program where if an employer wants to keep their people on, they can actually backfill some of the wages with unemployment benefits. The employer has to apply for Colorado Work Share Program. They can't reduce them any more than 40% of their normal hours. But what's very interesting is that as long as they keep the people on payroll, the unemployment benefit comes in and kind of makes up the difference there. So for a lot of people, for a lot of businesses that want to keep skilled labor or whatnot and want to keep their people, this is a really excellent way to look into it. So that would be number one. Also, through the state, we've got, Dana, I think you were going to post to the Facebook several different links. One's through for loans and whatnot through Colorado Small Business. West Metro Chamber of Commerce also has several links on there that you could look at. We on Lakewood actually have some information about the coronavirus. And then again, the state offers that Colorado Work Share Program, and you can just Google Colorado Work Share Program and it will come up. It's a 2-page application that's actually fairly simple. So I would encourage people to do that. And as a health insurance agent that I do all day long, every day, one of the things that I'm finding that most of the health insurance companies, where maybe either you're an individual and or you're an employee, they are being somewhat workable, I will say it that way, on the number of hours that an employer is keeping somebody online. Right now, a lot of times when you go to work for a business, they'll require that you work a certain number of hours to be eligible for insurance. What we're finding is that because the work hours are being reduced so much, the insurance companies are kind of saying, as long as the employer will continue to pay that premium, you as a whole can stay on the plan. So you and your employer may have to work out who pays the premium. You may have to do like COBRA or something like that. But I find that very interesting that all the insurance companies are saying, we understand it's really important to have this coverage right now, especially during a medical crisis the way we are. Here's some rules that we feel like we can, kind of ease up on. So I feel like that's kind of an important thing to know as well.
Yeah, absolutely. Thank you. Also, just want to also say that South Lakewood Business Association will be having, they're doing also a Zoom meeting.
A Zoom meeting, yay!
So everyone can learn how to use Zoom. And so they're having a meeting, is it Tuesday?
Tuesday morning, 7:30 a.m. And it'll be a Zoom meeting just like this. So you can go to the slba.co.org website and actually pull up the link, I believe.
Great. Yeah, and I just want everyone to know, we're all going through these same challenges right along with you. And, my husband's job currently is classified as essential. That could change at any time. We're as a family looking at where we can, cut things that we don't need and try to stock, create some more savings for us for and in case of an emergency. So it's uncertain times for everybody, and Lakewood is going to be continuing to work with state, county, everyone to try to get all of our businesses back up and running. And Lakewood is very dependent on our local economy, so we're all in it together.
That's right. That's exactly right.
One of the last questions we got was about schools. The question was a couple things. First, if we know anything about when schools are going to be back in person. we don't have any insider knowledge on this, but we know the governor just closed schools until April 30th. That was yesterday, which April 1st. And then, in listening to those conversations and in listening to what our president is saying, and as well, I am personally preparing for school to not go back in session this year. I'm just starting to mentally prepare for that, and what that's going to look like for our family. I don't know that that's going to happen, but I think that, I would encourage people to just kind of mentally plan for that, because I think that it's maybe even likely at this point that Jeffco schools would not open. But again, I just want to reiterate, I don't know that. I know the same thing you all know, but I'm just kind of reading between the lines and seeing, that's what I'm preparing for. The other question we had, and I just want to read some of this response that I got back, is for our seniors in Jeffco schools that are getting ready to, apply for colleges, or juniors that are applying for colleges, what's going to happen, because they've had, our state closed down schools, but not all the states have done that. And so, it's just another one of those really complicated issues. So I sent that question over to the Jeffco Public Schools, and at this time, the message that I got back is this is something that they are working on. They're working on this with high school principals, school counselors, central office staff to develop expectations for grading, especially for seniors. They're also reaching out to colleges and universities to determine what changes are going to be made to their admissions. They're working on this, and they hope to have more clarity in the coming weeks on this issue. So again, just to kind of say again, I'm just so thankful that we live in Jeffco, because Jeffco had remote learning going before a lot of the other school districts in the state. Right. So, I feel very lucky and very proud, frankly, of Jefferson County Public Schools. And, I know it's a challenging time. I can't really even imagine what it would be like to have a junior in high school trying to figure out their next path, and no one saw this coming. So I think we'll have answers as soon as possible, and that's about what we know.
I think that's all we know right now. Mm-hmm. Is that the sun will come up tomorrow, there will be plans made, and life will go on, and everything will be much better. So one day at a time. One day at a time.
Do you have anything else you want to say to the community before we kind of wrap up here?
I just wanted to give a couple of kudos that aren't related to the COVID-19. I saw that Lakewood was one of the highest in percentages of responding to the census, which is really excellent. Good job, everybody, for responding. The census is so important in so many different ways in terms of if there needs to be a new, districting on a federal basis can come into play. Same with, a lot of our funding from the federal government comes from census requirements. So it's really, really, really important. And thank you for responding the way you did. I think that's something. I think Sergeant Alesch also reminded us to not get on the playground equipment. Mm-hmm. And one other thing that I would point out is that includes the adult playground equipment. At Carmody, don't go do your workouts on that equipment. Same rule, because of the fact that, we don't want to pass it from one to another and or receive it from one to another. So, Mom always said, keep your hands to yourself. Now would be the time to do it. So that's the only thing that I would add. And I would say also, hats off. I am so proud of Lakewood in the way that everyone is really trying to honor all of these requires. And it's a pain. No one likes not being able to go and do the things that you normally do, but we're doing it. And I'm really proud of us for doing it that way.
Me too. And I think, the last thing I want to say is just really, I think that many other people have said this, but in Lakewood and in Jeffco and in Colorado and, the United States, I'm really proud of the way that people are stepping up to the challenge and up to the plate right now. We're seeing that in our own neighborhoods, even when we go out for our daily dog walk or more than one daily dog walk. We're seeing people,